Can you see the data show?
You haven't shared your screen yet.
No? Okay, sorry.
Okay, the green bottom on the bottom of your screen, there is a green option that says share screen. You have to click on that. Yes. And now, okay, you are sharing your screen. Please just open your your PDF or PowerPoint.
Okay. Now can you see?
Yes. Just
yes. Okay.
Yes. Yes.
Okay. Thank you. Good morning, good afternoon, or good evening to everyone. My name is Huang Ling. I'm a medical doctor from Brazil, infectious disease doctor. I am very happy to be here today to share this study entitled Why Patients Still Catch Hospital Infections Despite the Practice of Infection Prevention and Control Programs. I am infectious disease doctor for 29 years, but for the last 25 years, I've been studying traditional Chinese medicine and working in my own clinic using this kind of reasoning. And that is why today's presentation, I will show you the other points of view according to TCM. First, according to different points of view of other medical teachings, such as traditional Chinese medicine, the signs and symptoms of infections can have different meanings. In our normal medical practice, any redness, bronchial, or otherwise purulent secretion, fever, or urinary pain may indicate infection. But in TCM, they understand that this infection process is not only infection, but they understand that these patients are having energy imbalances that is leading to these manifestations. In this slide, I'm showing you that what we can see in this slide can be seen by different point of view, because Western medicine can see infection like this, so many rounds in this figure, but in traditional Chinese medicine, they understand different. They can see that this can be seen like this figure, and they can understand that these rounds can be explained by other point of view. And this is, I am saying that because depending on the angle and thus the point of view that you are seeing that infection, you can explain differently, and there are different points of view that we can treat that infection and not using only antibiotics. According to traditional Chinese medicine, for example, all the symptoms and physical, emotional, psychological illness are caused by the imbalance of what is referred to internal energy or qi in Chinese medicine. And the term energy in Chinese medicine or qi is characterized as the image of the steam rising from the pot of rice cooking on the stove. And the steam represents qi, and the body is the pot, and the rice and the steam is qi. In the different cultures in which qi concepts appear, it's also called life energy, life force, prana, bioenergy, as we can see in many studies. And this energy presents in our body is similar to electricity, the energy from the battery, power from the gas cylinder, or gasoline energy, or whatever fuel the car uses when filling up at the gas station. And in this table, you can see the evolution from health to disease. There are 5 phases. And in the first 3 phases, we can have only energy imbalances, but the laboratory exams are still normal. And Western medicine usually do the diagnosis in the phase 4 and 5, where are energy alterations. phase 4 is when they're cellular lesions, but they are reversible. And in the phase 5, the cellular lesions are irreversible. And that is why this is the main difference in TCM and Western medicine, because Western medicine are doing diagnosis in very late phase. And in these 3 phases, the patient has symptoms, but laboratory exams are normal. And this does not mean that the patient do not have anything. They have energy imbalances. And we need to treat in these 3 phases to do not evolve to this phase 4, where we could have the formation of many diseases in the laboratory exams. And in this case, the hospital infection. In the Oriental tradition, when disease occurs, it's a sign that there is an imbalance of the energy. And these imbalances are generally caused by emotional, wrong eating habits, or the influence of the external pathogenic factors such as cold, wind, heat, dryness, and humidity. And these energy imbalances can manifest in many ways. And in this case of discharge of pus, in traditional Chinese medicine, it means retention of humidity and heat. And when we treat this humidity and clear this heat, this infection could resolve without using antibiotics. Here are some foods that we could avoid and explain to the patient to avoid to reduce the formation of this humidity inside the body. And humidity is caused by the spleen pancreas energy meridian imbalance in the energy point of view, and it's not the organ itself, but it's the energy of the spleen in TCM that is leading to the formation of phlegm, leading to the symptoms of humidity in the infections. And that's why the avoidance of raw food and dairy products, sweets and cold water. These are the foods that can imbalance the spleen energy meridian, leading to formation of humidity. And excessive worry can lead to spleen energy deficiencies, leading to formation of this humidity and leading to signs and symptoms of infection. But in the energy point of view, it's only the spleen and pancreas meridian. And the excessive heat is leading to these hyperemia symptoms. And what is causing this excessive heat? It's when the patient has some energy imbalances between blood, qi, yin and yang. When there is energy deficiencies, there is a formation of heat inside the body, and that's why these deficiencies in energy can lead to manifestation of infection. But the real cause of this infection is not only the infection, is the energy deficiencies. And the patient could have heat retention due to the excessive eating of fried foods, egg, chocolate, honey, coconut, alcoholic beverages, melted cheese, all dairy products. All these foods can induce internal heat formation. And this is the balanced state that we need to aim in all this treatment between yin and yang energy. And these are the many yin and yang energy imbalanced states. What we need to have in all the treatments is the yin and yang balanced state. And when we have, for example, yin deficiency and yang energy is more more than in this situation, we have such as diabetes formation, women in menopause, anxiety, many other obesity can lead to the, it's from these energy imbalances, for example. And here are some, the 5 questions that we usually need to ask the patients to see how is the energy of the 5 energies that command the functioning of our body. Is the question is the patient go to bathroom every day? If the patient do not have daily bowel movement, this means blood deficiency in TCM. Qi deficiency is when the patient has abnormal sweating during the day, even not doing any exercise. And when the patient has indeficiency is when the patient has hot flashes, and when the patient feels colder, mainly in the extremities, this means yang deficiency. And when the patient has bleeding gums, bad breath, abdominal pain, microhematuria, or itchiness, this could be a sign of heat retention. And here are some procedures that I usually do in my daily practice using only acupuncture to rebalance this internal energy, and using high diluted medication to treat all this kind of infection, because this infection in TCM, they do not mean infection, but if you clear the heat and if you balance this energy state, you can treat infection condition without using antibiotics. Here are the 3 figure that I'm demonstrating the different viewpoints between Western medicine and between traditional Chinese medicine. This tree symbolizes the human being, and this tree has a trunk with several branches. Each branch represents one medical specialty, and coming out of each branch, you can see many leaves. And what we are treating nowadays in Western medicine is in the leaf level, such as, for example, if the patient in the hospital has pneumonia, we are treating in the pneumology or infectious disease branch. But according to traditional Chinese medicine, all these manifestations in the leaf level are in the root of this tree that Western medicine does not understand yet, and they are only treating the leaf. And that is why when we treat the root, that are the energy imbalances, and considering the influence of the external pathogenic factors that are the influence of cold, wind, heat, dryness, and humidity, and preventing these entrance from the body, you can stabilize the energy imbalances and leading to a cure of that infection, for example. And here's the root of this tree, that are 2 theories that are yin yang theory in TCM and the 5-element theory. The 5-element theory, they are saying that all the things that exist in our world are related to these 5 elements and yin-yang theory. For example, inside the body, the 5 elements corresponds to the wood, fire, earth, metal, and water, and each element corresponds to one massive organs, such as wood represents liver, fire to the heart, earth is spleen, metal is lung, and water is the kidney. And one organ is, they are interconnected by the energy flow, different from the Western medicine point of view, that they understand that each organ works separately and they don't have any relation between anyone. But and in TCM, they understand that one massive organ is responsible for one external sensorial organ and formation of internal energy, such as wood or liver is responsible for ion vision, fire is responsible for the heart and communication and sleeping process. The earth is responsible, the spleen is responsible for the absorption of nutrients and the formation of blood, and metal is responsible for the distribution of the energy inside the body, and the smell the process of smell. And the kidney is responsible for the hearing process in the ear, and also for the reproduction, for the sexuality, for the bones, teeth, and memory and concentration. And here's only to show you the 5 elements and the internal 5 massive organs that they are responsible. And these are the energies that we need to understand, that all the patients that we have nowadays, they are sick because they have these energy imbalances that is manifesting in many diseases. And when there is energy deficiencies, there is a formation of internal heat leading to the infectious process. In this case, the patient could have community infection that could be leaded to this process, and he could have hospital infection, but the hospital infection manifestation could be related to these energy imbalances leading to symptoms of hospital infection. According to Galen, Western medicine thought is based on Galen thinking. He's a great Greek physician that lived 500 years after Hippocrates, and he wrote many theories about the functioning of human body, which are implemented in all medical schools nowadays. And his theory is, as I show you, all the organs and systems are self-sufficient according to Galen. But this is different from the TCM point of view, that all the organs and systems are interconnected and one can influence the other. And according to Hippocrates, the father of medicine, he said that every physical body has in itself the elements to recover, as nature itself is the only healer, and the physician simply limited himself to accompany and obey nature. And that's why I have so many publications nowadays showing that if we treat these energy imbalances that Hippocrates is saying, we can treat all kinds of infection, and in this case, hospital infection too. Here is to show you that when the organ is ill, he can generate an internal heat, and this internal heat may simulate an infectious process, and the treatment with antibiotics will worse even more these internal energy imbalances and leading to more internal heat formation. That is why when we say that the bacteria is resistant to antibiotics, there is an energy imbalances that leading to this resistance too, because these antibiotics is leading to energy imbalances, leading to more internal heat and formation of more infectious process inside the hospital. And when we use antibiotics, we can lead to less internal vital energy. And in this vital energy can manifest formation of more internal heat, leading to more infectious symptoms. And this is the use of all high concentrated medication according to Arndt-Schultz law will reduce even more the vital energy of these patients and leading in this case to weakness state and will lead to more formation of internal heat and leading to more manifestation of infectious process. And that is why nowadays it's better if we can use high diluted medication in our patients to reduce this reduction in the vital energy and reduce the complications. Here's to show you the different point of view about the ingestion of temperature, different temperatures of water, because nowadays here in Brazil, I have a problem because in hospitals, they usually serve to the patients very cold water to patients, even they have pneumonia or are in the UCI or they all give to the patient cold water. And this is an example in China. I went to a hotel there, and inside the hotel, they have this tap of water that has a blue one and a red one. The blue one is the warm water. They usually drink warm water, and warm water is a normal temperature to drink, because warm water at 32 degrees is the temperature of the inside the body. And this red one is boiled water to drink tea. So normal temperature to drink water in China is warm water. Sorry. Here is to drink warm water is better to reduce the formation of hospital infection, because if you drink ice water, you will formate more internal heat and lead to more infectious process. This is the situation when there is spleen pancreas energy deficiencies due to wrong eating habits, leading to edema of the patients. And this can lead to this menstrual cycle, menstrual process in the whole month in the woman, due to a spleen pancreas energy deficiency, because spleen and pancreas is responsible for the maintaining the blood inside the vessels. And when there is a spleen and pancreas energy deficiency, the woman can menstruate in whole month, and because of these energy deficiencies. Here are some examples of energy imbalances between 100 patients that I had in my clinic, that yin and yang deficiency, yin and blood deficiency, yin and blood deficiency. There are so many combinations that one combination can lead to many manifestations of symptoms and disease. And many disease can have many energy imbalances, and one energy imbalances can lead to many disease manifestations. Here's to show you that even this patient that has a accident in car, by car, and here you can see that he could have energy imbalances before going to the hospital. And this man, you can see that he's obese, he could have wrong eating habits and emotional problems before admittance in the hospital. And he could have more energy imbalances when admitted in the hospital due to the stronger medications that he would receive, and leading to complications of his process. And here's to show you that the use of fans and air conditioning in the hospital could be another reason for increase of hospital infection, not due to the contamination of these devices, but due to the generation of wind and cold and entrance to the patients, and leading to energy imbalances, leading to complications. And that is why when you use this fan, you need to not to put the air in directly into the patients, and you need to cover the patients appropriately to don't allow the wind and cold go inside the bodies of the patients. And here is to show you some possible conditions that the air and the wind can interest the patients and complicate this, because this patient is very weak in energy, and he is not will not have protection against this invasion. And when the wind and cold invasion this patient, it will cause energy imbalances, leading to the future infection. And also when the newborn is born in the surgical You need to cover quickly this newborn because he could get cold and begin the infection, upper respiratory condition. And also when patients are taking bath, you need to close the windows and the doors to don't allow the wind and cold to go inside these patients. And this is a very common situation when you see when the patient have fever, they can usually put more ice to reduce the fever. This is wrong. This is not a good thing because normally the patient is having fever because of the entrance of cold and wind. And the first manifestation is the fever. And when you put more ice in the patient, you will worsen even more the entrance of cold and will worsen the condition of the patients. Here's to show you that the diet in the patient, you need to choose the diet that is not made from cow's milk, because cow's milk can induce more formation of secretion. And the water that you are washing this tube, it's better to boil this water, not to reduce the contamination also, but you need to change the energy of this water that normally is cold to a neutral water, to don't induce spleen and pancreas energy deficiencies and leading to more absorption of these nutrients also. And the liquid that you are using this device, normally in Brazil they put cold water here, and this cold water can induce many energy imbalances when entering the body. That's why it's better to put the warm water here. Here's to say that to understand how to control hospital infection, nowadays we need to understand also other kinds of ancient medical traditions, not only Western medicine, but because only Western medicine reasoning can control only 1/3 of all hospital infections. And we need to understand all the other ancient medical traditions to understand how to control in the deeper sense the hospital infection nowadays. And the conclusion of this study is that we have to attempt to explain the possible causes of implanting our infections control measurement. And the patients continuing to contract hospital infection, we need to understand how the human body works in the deepest level, in the energy level. And here's to show you that the use of antibiotics and all high concentrated medication are inducing more energy deficiencies and leading to a weakness state and leading to more infection complications. And not the use of antibiotics is leading to increase in the infection, but all high concentrated medication are increasing the hospital infection nowadays. Okay, this study was published in this article. If you want to read, it's on the internet. Thank you for your attention. If you have any question, I will be very happy to answer you. Thank you.
Thank you, Dr. Huang, for the wonderful presentation. It's really interesting to shed light on the traditional medicine, especially at the level of the infection and infection control. Does anyone of the audience would like to have a question or post a question in the chat box for Dr. Huang?
Yes, Elvesa. Thank you again, Dr. Huang, for this for sharing your